Hello there. Thanks for tuning in to the Highmark Health Options Health Awareness Series. We're glad you're here. Today we're going to talk about vaccinations and childhood screenings. What are they? How do they work? And why do you need them? This is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified health provider with any questions or concerns about your health. Here are the topics we will cover. What are vaccinations? How do vaccinations work? Why should you get vaccinated? Vaccinations for children and adults, COVID-19 and flu vaccinations, and other vaccinations. Let's get started. What are vaccinations? Vaccinations are also called immunizations or shots. They contain very small amounts of weak or dead germs that cause diseases. When the germs are injected into the body, they prepare the body to fight the disease faster so we don't get sick. These germs are either bacteria or viruses. Let's talk about the immune system. We are born with an immune system that knows if a germ enters the body and will fight it. When the body encounters a germ, it can take several days to make and use all the germ-fighting tools needed to get over the infection. Once the body fights a certain germ, the immune system will remember it and protect the body from that germ in the future. How do vaccinations work? Vaccines contain weak or dead germs that trick the body into thinking there is an infection, and the body makes antibodies to fight the infection. Once antibodies are produced, the body will recognize the germ and remember to fight that germ if we encounter it again. Why get vaccinated? In the United States, vaccinations have greatly reduced or eliminated many infectious diseases that once caused death or disability for children and adults. Vaccinations can lower your chance of getting certain diseases. Every year, tens of thousands of Americans get sick from diseases that could have been prevented by vaccinations. Some people are hospitalized, and some people even die. Let's talk about vaccinations for children and adults. Remember, we are born with an immune system. Newborn babies are immune to many diseases at first because they get antibodies from their mothers. However, the immunity goes away during the baby's first year of life. When a child is exposed to germs that cause disease and they have not been vaccinated, they may not be able to fight the disease. When children get a vaccination, they are receiving protection from the disease without having to get sick. This is the vaccination schedule for children. Please note, if your child misses a vaccination, you don't need to start over. Just go back to your child's doctor for the next vaccination. Talk with your child's doctor if you have any questions about vaccines. Why do I need to get vaccinated if I'm an adult? That great immunity to disease or illness that vaccine provide can wear off over time. There are factors that can put you at risk for some diseases. Those include age, certain health conditions, job, lifestyle, and travel. Let's talk about COVID-19 vaccinations. Children aged 6 months to 4 years may require multiple vaccinations to be considered up to date. Everyone aged 5 and older should get the updated COVID-19 vaccine. People who are immunocompromised may get additional doses of the updated vaccine. As always, talk with your doctor about what makes sense for you. Let's talk about flu vaccinations. The flu can make people very sick. For some, it can lead to going to the hospital and sometimes even death. The CDC, or Centers for Disease Control and Prevention, estimates that during the 2022 flu season, the flu was associated with more than 9 million illnesses, more than 100,000 hospitalizations, and more than 5,000 deaths. The best time to get the flu vaccine is before the flu viruses start spreading in the community. Early fall is the best time. Does the vaccine work right away? No. It takes about 2 weeks for it to begin working. Why do you need a vaccine for the flu every year? First, the immunity goes away over time. Second, flu viruses are always changing. The vaccine may be updated each year to provide the best possible protection. There are other vaccinations you may want to consider getting. Shingles is a painful rash that can last weeks to months. We are more likely to get shingles the older we get. The vaccine is given to adults age 50 and older. There are 2 pneumococcal vaccinations that adults should receive. One vaccine between age 19 to 64 and another at age 65 and older. These vaccines protect against pneumonia. Both DTaP, diphtheria, tetanus, and pertussis, and Tdap, tetanus, diphtheria, and pertussis, help prevent whooping cough or pertussis. Those who should receive this vaccine are adults who have never received a dose, pregnant people, and those who have not had a dose in more than 10 years. Hepatitis B is a virus that can cause serious health problems, including liver damage, cancer, and death. Hepatitis B spreads when someone comes into contact with bodily fluids from someone who has it. It can be spread through sex, sharing needles, or other drug injection equipment, or from a mother to baby at birth. The hepatitis B vaccine is recommended for all adults age 19 to 59 and adults age 60 and older with risk for hepatitis infection. The HPV vaccination protects against certain types of cancer, including cervical cancer. This vaccination can be given to girls and boys starting at age 9 and given up to age 26. Talk to your doctor to find out if you are at high risk for catching the HPV virus. Infants aged 2 months and younger can get whooping cough and the flu, but vaccinations for these illnesses do not begin until infants are 2 months old. A pregnant person should receive the Tdap vaccine to protect against whooping cough during pregnancy and the flu, so the protection can also be passed along to the baby. Now, let's talk about lead poisoning and prevention. Lead is a toxic metal used in a variety of materials and products that are found in your home. Lead can get into the bloodstream, and this is called lead poisoning. When lead is absorbed into the body, it can poison and cause serious damage to vital organs. Lead poisoning is especially harmful to children under the age of 6. Even low levels of lead in the blood have been shown to affect a child's ability to pay attention, academic achievement, and IQ. Lead poisoning is dangerous because the effects of lead exposure cannot be corrected. If the level is above the acceptable range, the doctor will provide treatment information and test the child's blood every few months until it is within a normal range. If the level of lead in the child's blood is extremely high, the doctor may prescribe medicine. The only way to know if your child has lead poisoning is to have a doctor perform a simple blood test. Children enrolled in Medicaid are eligible for free testing. Lead poisoning doesn't often show symptoms unless blood lead levels become extremely high. Symptoms of lead poisoning are similar to those of influenza or viruses. In fact, the symptoms are common to many forms of illness. They include headaches, irritability, stomachache, vomiting, constipation, muscle weakness, sleeplessness, loss of appetite, loss of energy, hair loss, anemia, confusion, and seizures or convulsions. Let's talk about prevention. The most important step you can take is to prevent lead exposure before it occurs. To prevent lead poisoning, stop your child from coming into contact with lead. Find and remove sources of lead in the child's environment. Common sources of lead are paint in buildings that were built before 1978, soil and dust, and water pipes. Find out the year your home was built. If your child spends a lot of time somewhere else, such as a grandparent's home or daycare, you should also find out the year that place was built. In homes or buildings built before 1978, assume that the paint contains lead unless tests show otherwise. Be aware there is also likely to be lead in the soil around older buildings, either from the exterior paint or from vehicle emissions. Contact your local water authority for information about the lead content of your tap water. You cannot see, taste, or smell lead in drinking water. If you have a lead service line, ask if there are any programs to assist with removal of the lead service line going into your home. Some consumer products may contain lead, though it includes toys, jewelry, makeup, foreign-made containers and cans, and food and beverages stored in unglazed or unfired pottery. The best way to protect your child is by taking preventive measures, including have your home tested for lead paint, especially if it was built before 1978. Don't renovate until your home has been inspected for lead. Home repairs like sanding or scraping paint can make dangerous lead dust. Clean windowsills and floors regularly with a damp paper towel and throw the towel away. Make sure your child does not have access to peeling paint or chewable surfaces painted with lead-based paint. To prevent lead poisoning, let water run for a few minutes before using or consuming it. Use lead-free dishes when eating food. Store your food in glass, plastic, or stainless steel containers. Wash your child's hands, face, and toys regularly. Always wash hands before eating and sleeping. Remove your shoes before entering your home. If a woman is exposed to lead during her pregnancy, her developing baby can also be exposed. Too much lead in your body while pregnant can put you at risk for miscarriage, cause your baby to be born too early or too small, hurt your baby's brain, kidneys, and nervous system, or it can cause your child to have learning or behavior problems. What do you do if you or your child has lead poisoning? If your child has a high lead level, there are things you can do to help. As we discussed, removing sources of lead is an important step. You can also make a plan with your doctor. Work together with your doctor to find the best treatment for your child. Ask questions if you don't understand something. If needed, you may need to go back for a second lead test and have your child tested for learning and developmental problems. If your child has lead poisoning, feed them healthy foods with calcium, iron, and vitamin C. These foods may help keep lead out of your body. Calcium is in milk, yogurt, cheese, and green leafy vegetables like spinach. Iron can be found in lean red meats, beans, peanut butter, and cereals. Vitamin C is in oranges, green and red peppers, and juice. Dealing with lead poisoning can be stressful. Be sure to ask for support. Contact your local health department. Trained staff will answer your questions and connect you to other resources in your community. You may want to talk to other parents who have children with lead poisoning. Finally, additional resources are available on the CDC website at cdc.gov/lead. And that brings us to the end of this topic. If you would like to learn more about the Health Awareness Series and watch other episodes, visit hho.fyi/HAS. Thank you for joining us. We'll see you soon.